There's a question. Okay, so what would be the next? So this is for our myeloma gurus. So what would be the next treatment option for someone on their first relapse after a stem cell transplant for IgG kappa myeloma in January 2016? My first line of treatment was Velcade, Cytoxan, dexamethasone, so Cybor-D, and now taking 4 milligrams of Ninlaro for maintenance.
Oh, okay, great. So first of all, I'm really glad that you had, your first relapse probably about 6-7 years after initial diagnosis. That's usually a good indicator of the kinetics of the disease. Your disease is not a fast growing disease, which is a good sign. Now, we often decide the next cocktail of treatment based on whatever drug you've been exposed to in before. So if you've seen Velcade, dexamethasone, Cytoxan as your first line treatment, and you've had stem cell transplant and Ninlaro for maintenance, it doesn't seem to me like daratumumab is something that your disease has been exposed to. So we have excellent data with all the daratumumab trials in first relapse, second relapse, etc. So that would be a very efficacious drug that I would first introduce in the first relapse setting. In terms of the daratumumab can be combined with an immunomodulatory agent or PI. Now you've seen Ninlaro as well as Velcade. So again, I think a daratumumab-based combination is what I would go for, either paired with lenalidomide, or if we can re-challenge you with Velcade if you don't have any peripheral neuropathy, or we can also consider carfilzomib as well as a pairing with daratumumab. And the third drug would, of course, be a steroid backbone with dexamethasone based on how much you can tolerate it, 40 versus 20 based on your previous tolerance to dexamethasone.